Serving all of San Diego, this is your Fox 5 News.
You got some little kitties in the room. Why don't you just scoot them out? Okay, because we're sorting out what's fact and fiction. Are they out surrounding sex and during pregnancy and postpartum? And they asked me to do this. Isn't this fun? Oh, well, Dr. Irwin Goldstein, editor-in-chief of the Journal of Sexual Medicine, and Dr. Rose Hartzell. She's a sex therapist at San Diego Sexual Medicine. They're here with a look. This is some new findings. Good morning.
Good morning. First of all, thank you so much for doing this. Fox 5 is awesome.
Oh, thank you.
Just to tell the audience, there's 4 babies every minute, 10,000 every day, and 4 million every year just in the U.S. So
just in the U.S.
We're talking about a lot of women who are pregnant.
Okay, we're talking about women who are pregnant and men that are with the women that are pregnant.
Right.
It comes down to when a woman's pregnant, okay, let's stop.
Right, so there's a lot of myths. So we're going to try and debunk some of these myths.
Are we ready?
We are ready.
We are ready. Okay, let's get through these myths. Myth number 1, some say that sex during pregnancy could harm the baby. I've heard this before. Not good for the baby, don't do it.
Okay, so rare. There are times when the placenta is low, the cervix is early dilated, the vaginal bleeding happens, multiple babies inside. Rare stuff. I mean, if you're concerned, go see your doctor.
Okay.
There's a lot of positive things about relationships, and we're going to talk about that right now.
Yeah, sex during pregnancy is actually good for the relationship, and if you don't have those contraindications, then you might need to make some physical changes, change the position, because there's be a little creative because the body is different, but for the most part, it's actually good for the relationship.
All 9-10 months, go for it.
Go for it.
Okay, myth number 2, sexual desire decreases during pregnancy. The moms are going, oh my gosh, I'm so tired.
And nauseous and other things. But the reality is, during the second trimester, a lot of women who say, I have more desire than I've ever had, and sex has been the best for me.
In second trimester,
Second
really?
trimester, yeah. Testosterone's highest at that point, by the way.
What happens in the third trimester?
Things fall in the third trimester. The baby's descending. You're the biggest possible, so there's a lot of physical
I like that, Dr.
issues.
Goldstein. Thank you. You're the biggest possible.
There's hemorrhoids and God knows what else we're talking about here. So the thing is, the third trimester is the least likely time.
Okay. Here's myth number 3. Vaginal childbirth results in decreased sexual satisfaction. Is that a myth or not?
You go, because it's definitely a myth.
Yeah. Really, the mode of delivery isn't as important as the couple's communication and satisfaction with each other. The truth is, if a couple is satisfied, if they're communicating well, and if they're, once again, being sensual, maybe if you can't have sexual activity right after intercourse, trying different sexual activities that you can engage in, the mode of delivery doesn't make a difference.
Okay, here's a myth.
This is a time for fun and exploration and innovation, and that's what's cool about pregnancy, honestly.
You're so awesome. All right, here's the final one. Women are the only ones whose sexual health is impacted by pregnancy and birth. What's the truth?
Well, men get affected.
Oh, yes, they do.
That's why the communication is so important. Men could be watching for the first time something that they may remember not to be like it was at the beginning when they were dating.
Right.
But I mean, this is just being a father and a mother and growing up.
And they get scared too sometimes, right? Like they say, oh, I don't want to hurt the baby.
I don't want to hurt the baby, or I don't want to hurt the woman. After they've seen the birth, it can be a little scary for the man. She doesn't want to hurt her partner.
Okay, so
there's a 5th myth.
Oh, there is?
Yes, the 5th myth is if you have sexual problems that persist beyond the 6-month mark.
Yes.
Go see a doctor.
Go see a doctor.
Some people say, ever since Johnny was born, I haven't been the same, and I say, it's going to get better, it's going to get better. But go see a doctor, we can help make it better.
Well, Dr. Goldstein and Dr. Hartzell, thank you for being here. The takeaway from this is have some fun, right? Don't let having a baby stop you from anything.
This is about a sharing experience.
You can learn more about both of them at the San Diego Sexual Medicine at Alvarado Hospital, fox5sandiego.com. Click Scene on Tap. Did you learn something, Raul? Because I sure did.
Yes. We mentioned that activity actually helps with the natural birthing process, yes?
Yes.
And that's true. It's the
What, it helps with the birthing process?
Yeah.
Yes, it relaxes you.
It helps.
How did you know that?
I have a 15-month-old baby.
And he's very active.
That's why we love that. Our favorite guest ever. But you're right about after the baby's born. That's a whole different set of rules, and it's a whole deal. Thank you guys so much.
Thank you
I
so
love it
much.
when you guys are here. Always take my notes. All right, thank you guys.